Good day, everyone. My name is Claire O'Coin. I am a third-year medical student at the Medical University of South Carolina, and I will be presenting on behalf of my co-investigators the incidence of severe maternal morbidity among admitted pregnant patients with COVID-19. The objective of this project was to determine if severe maternal morbidity was more common in COVID-19 infected pregnant patients compared to uninfected pregnant patients. Regarding the relationship between pregnancy and respiratory illness, there's evidence of various respiratory infections being correlated with pregnancy complications. For example, bacterial pneumonia is associated with eclampsia and increased cesarean section rates, while SARS is associated with DIC. The COVID-19 infection has also had many unanticipated effects outside the respiratory system in non-pregnant patients, such as acute kidney injury, stroke, and nervous system dysfunction. When investigating the current literature on COVID-19 and maternal morbidity, the few relevant studies often had contradicting results for the presence or absence of an association between COVID-19 and postpartum hemorrhage, thromboembolism, or hypertensive disorders of pregnancy. Our patient population included all admissions of pregnant patients into inpatient MUSC facilities from March 1st, 2020 to February 28th, 2021. COVID-19 diagnosis was determined if the patient had a positive PCR test while they were pregnant. A medical records query was performed for each of the COVID-19 positive and negative cohorts. The incidence of any of the 21 severe maternal morbidity indices, as defined by the CDC during pregnancy, were recorded and compared between cohorts using chi-square or Fisher's exact test. The table depicts the incidence of severe maternal morbidity indices found for each cohort and the odds ratio of the likelihood of developing that SMM condition between the two cohorts. Overall, COVID-positive patients were more likely to have any one SMM compared to uninfected patients. Pregnant patients with COVID-19 were more likely to develop ARDS, have a blood transfusion, or have a hysterectomy. In addition, Black patients were found to be more likely to have a COVID-positive test and have any one SMM condition. And when stratifying for race, the association between COVID and severe maternal morbidity was only significant among white patients. Based on the findings for blood transfusion and hysterectomy, it is possible that a COVID-19 infection could increase the risk of hemorrhage due to the virus's documented effects on coagulation. For the ARDS results, one study found that globally, ARDS is present in 33% of COVID-19 patients, regardless of pregnancy status. And the associations between Black patients and the COVID prevalence and the SMM incidence are most likely due to structural racism and racial health care disparities. It is also important to note that at the beginning of the pandemic, COVID-19 testing was not universal, and testing all admitted patients at MUSC did not happen until May 2020. We are planning to investigate these relationships further and evaluate SMM in COVID-19 patients using a national database. Thank you for listening and have a wonderful day.